Just like living in a food desert makes it hard to access food, doctors serving minority communities are often in an information desert. This makes it hard for them to access the latest care plans for diseases like diabetes.
It sucks. Diabetes affects your emotional well-being, your stress level. It's a 24-hour thing.
More than 30 million Americans like Angela have diabetes, a condition where there's too much sugar in the blood. And things are worse for minorities and older adults. Diabetes rates on Chicago's South Side are nearly twice as high as the national average. I'm creating a virtual tool to help make information accessible to community doctors so that they can better treat their patients. We'll focus on diabetes to start and grow from there.
We want people to have higher quality of care. Part of that is physicians being able to have enough information, skills, and tools to provide that high quality of care, particularly in settings where patients may be resource poor, where there may not be as much information given to physicians.
Studies show that doctors update their treatment plans based on what their peers are doing, and computer programs can chart how this causes differences in diabetes care. Just like the Sims video game mimics real life, my tool will use data from patient surveys, healthcare, and more to map out how doctors spread information. The simulation will also let us test potential solutions that cost much less because it starts in the virtual world, such as adding diabetes education programs at hospitals. We'll measure how these programs would impact diabetes care before launching them in the real world.
This study will allow us to figure out how physicians find and spread information amongst each other so that we can maximize the chances that doctors are at the top of our game in treating patients, including those who are most in need.
There's knowledge that I don't have that I'm expected to get from my doctor. She would be up to date on what she needed to be up to date on to help me more. I would feel a lot more reassured that she's actually being able to provide me with the best care possible.
This technique could be applied to any number of public health problems, including drug prescribing behavior. It has powerful potential translation to other areas of medicine.